Hi, I'm Dr. George Springer. I practice functional medicine here at LifeWorks Wellness Center. We're going to talk about something near and dear to my heart, it's children's health. And I say near and dear to my heart because I'm a father of 5. And so I identify with the parents I see coming into my office often because they want something different for their children. And of course, they always want the best. And we all as parents want the best for our child. And what is happening more and more over the years I've been in practice is that parents are beginning to take a closer look at the traditional model that exists in terms of the care for their children. They're looking for something besides the antibiotics that just continue to pour out of the pediatrician's office. They're looking for something besides the ear tubes or the tonsillectomies. And these are the kind of things that kids are facing all the time and questions with that. They want something besides those antibiotics. In fact, there's a lot of studies out that show that even one round of antibiotics before the age of 3 actually increased the risk of asthma and allergy by some 8 to 10%. Those are not small studies. There are 400 kids, 12,000 kids, 22,000 kids. That shows that antibiotics can cause those issues. And of course, here at LifeWorks, we identify and know why those antibiotics cause those issues. That's not to say that antibiotics aren't necessary and very sometimes life-saving. But the thing is they're used too routinely. A good example was one of my patients that brought her grandson down from Seattle. And his little name was Jackson. And Jackson had basically progressive problems with breathing and asthma from the time he was born. And to the point where they actually put him on 50 days of antibiotics. And that didn't resolve anything. And then they decided to take his tonsils out. That didn't resolve anything. And his asthma and breathing was getting progressively worse. They brought him down here, and we identified some of the causes that were bringing that into effect. A lot of them are digestive in nature that weren't being identified because that's not the model that is practiced conventionally. The long and short of it is we identified those things, corrected his digestive system, got rid of some of the allergies that were food-based and not necessarily environmentally based. And Jackson today is not asthmatic and he does not have the allergies. And we were able to accomplish that for someone living several thousand miles away. But that's the kind of thing that we want to be able to bring. Patients want something different for their kids. They want their kids put on Ritalin or Focalin or Adderall or those things for ADD and HD. They want some help that maybe looks more naturally at those kinds of issues. Because certainly we want our kids to get a good education and we want them to do well behaviorally and socially as far as school is concerned. But putting them on some kind of medication, many parents want to get beyond that. And that's what we do here. We actually look at the child and treat the child just like we do our adult in as much that we get to the causes of the imbalances that exist in their body. And that's all the way from their digestive systems. And that's a lot of places, where we begin to see the issues with our children is that their digestive system, because of the medications they have been on, sometimes because of diet, but we take the whole body approach to really making sure that we can address those issues. So if you have a child that is having difficulty with their school, perhaps not performing as well, having some attention issues, perhaps there is an autism spectrum disorder that we can begin to address. We've had a lot of good experience, and I love working with kids to be able to help them get back to their full potential. So I hope you'll call us here at LifeWorks, and I'll be glad to try and help you with your child.